Hi, everybody. Welcome to PermanenteDocs Chat. I'm your host, Alex McDonald. For those of you who don't know, I practice family and sports medicine here in Fontana, California, as part of the Southern California Permanente Medical Group. So thanks all for joining today, whether you're watching live or on Facebook or listening to this after the fact. Please be sure to check out and share our current and our past chats on the Permanente Medicine YouTube page. Just search Permanente Medicine YouTube and you'll find us on a lot of great content there. So I'm really excited to welcome our guest today, Dr. Tracy Lippard, who is an internist and geriatrician from the Colorado Permanente Medical Group. And since November is Alzheimer's Awareness Month, we are going to talk about all things Alzheimer's and some new and emerging information, and just remind us all about how to practice really good care for our patients with suffering and struggling with dementia, and family members too. I guess I should add that. If you have any questions, feel free to drop them in the chat or post them in the comment section on Facebook. We'll try to get to as many as we can. And so, Dr. Lippard, thank you so much for joining us. We're just going to jump right in. Tell us briefly kind of who you are and what you do.
Sure. So I'm Tracy Lippard. I'm an internist and a geriatrician. I have practiced here at Kaiser Permanente in Colorado since 2006. And I also serve as the executive director of complex needs, community health, and government programs.
Great. So just a couple hats. So thanks so much I'm sure you have a busy schedule. So thanks again for joining us. Well, tell us a little bit about kind of, Alzheimer's Awareness Month and some of the impact on our nation regarding Alzheimer's disease. I know it's a huge impact, both emotionally and financially, to a lot of patients and a lot of families as well too. So tell us a little more about the impact of Alzheimer's disease.
Certainly. So as the population ages, we're certainly seeing an increase in the number of people with dementia because people are living longer, and being older is the biggest risk factor for developing dementia of all types, including Alzheimer's. The interesting thing to note, though, is that because of improvements in the last 50 years or so in health and lifestyle and education levels, and not smoking so much, statins, all of these things, what we're actually seeing is that there is a decreasing age-specific incidence in dementia in a lot of high-income countries, including the United States. But still, 1 in 9 Americans 65 and older has dementia. 2/3 of those are women, and Black Americans are twice as likely as white Americans to develop dementia later in life. And the caregiving burden is significant. 1 in 5 Americans is a caregiver, and many of those people caring for people with dementia.
Wow, that's those numbers are just staggering when you think about the number of patients that we care for and how it impacts the health of so many different other conditions as well, and downstream effects. You mentioned, and I was going to get to this later, but I think I'll ask you this now, some of the health equity issues here, knowing that a lot of sort of the treatments and prevention of Alzheimer's and dementia, which we'll get into later, relate directly with socioeconomic status, employment, food security, a lot of sort of other health equity issues wrapped up in that as well too. So can you delve a little bit more into sort of that health equity piece of this and just the increased burden that it puts on more vulnerable populations as well too?
Yeah, absolutely. And I do think we'll get into some of these risks a little bit later, but the risks for dementia that are potentially modifiable and things we can mitigate really are not distributed equally. So population-based strategies are just essential for decreasing health inequity. And this really includes policies from promoting and prioritizing childhood education, having clean air, clean water, not lead in the water, access to healthy foods, and really making sure that we've got safe neighborhoods, safe places to work, to play, to exercise. And all of these things do impact communities that are socioeconomically disadvantaged. And caregivers in particular have so much strain. They oftentimes neglect their own health because they're caring for their loved ones. They have higher rates of depression, and they suffer from financial strain. And caregiving also disproportionately impacts underserved communities. So it kind of creates this vicious cycle.
Yeah, it sounds like many of the sort of the social determinants of health and some of the pieces as a family physician and primary care physician myself, those are some of the things I struggle with the most. Is if a patient comes with an infection, I can give them an antibiotic. It's a very easy solution. If they can't afford their insulin and they don't have a safe neighborhood to go for a walk, that is so much more challenging and beyond sort of what we feel like we have control over too. And I imagine it seems like Alzheimer's and dementia is very much in that same category as well. Can you talk some more about the evidence about some of the prevention here? Because that seems like that's kind of the key, is the prevention versus the treatment of Alzheimer's. Is that a fair assessment?
That is a fair assessment. I think that treatments so far have been very disappointing. And so prevention is just critically important. Anybody would rather never get dementia in the first place than have dementia that needs to then be treated. So I think that the 2020 report of the Lancet Commission that really looks at all of the different modifiable risk factors for dementia really finds 12 things that if we can do these 12 things, we could either prevent or delay the onset of dementia in about 40% of cases, which is astounding. I mean, if we had medications that worked that well, that would be lovely.
Right.
So the 12 things are really both things we can do as a society. It's that early childhood education and things like that, and things that we can do individually. So it includes making sure that we're treating hypertension, preventing and managing diabetes, preventing head injuries. Head injuries are a big risk. Not smoking or helping people quit smoking, reducing air pollution, reducing obesity, treating hearing impairment, making hearing aids more affordable is a big piece of that. Maintaining good social connections, which has been so challenging in the last few years of the pandemic, but it's really important. We already mentioned education, physical activity, exercise is really powerfully protective. Treating depression and avoiding excessive alcohol use. And the thing that I love about this list is that this is bread and butter primary care. This is what we do. And I think that it's powerful to know that we can have such an impact in reducing the risk of dementia for our patients.
Yeah, I mean, those of you who've seen me here before, I feel like I'm always preaching the same thing. I'm a huge lifestyle medicine proponent. I always tell my patients, diet, sleep, exercise, stress relief, social connections are going to do more for you than any medication I could ever prescribe or think about as well too. And it sounds like this is no different when it comes to preventing dementia and reducing this huge burden of disease in our population.
And it's good for so many other things as well.
Right. Exactly. Yes, absolutely. 100% agree. Well, there's already a question in the chat about some treatments. So let's move on here. Tell us, as you mentioned earlier, treatments have been disappointing, which I think is an eloquent way to put it. Tell us about, historically, some treatments for dementia and for Alzheimer's. And then also there's a lot of information in the news recently. There have been some new medications which have recently been approved amid some controversy, I guess I shall put it that. So can you tell us a little bit more about that as well?
Yeah, I'm happy to. So we have no cures or even disease modifying treatments, medications for dementia. And that certainly includes aducanumab. And medications have been disappointing. I mean, I think plain and simple. There is from KP, we have an emerging therapeutic strategy program that convenes interregional subject matter experts to go through the evidence and think really thoughtfully about what we should do with these new medications coming out. And there's really a strong recommendation not to use aducanumab based on lack of evidence of any clinical benefit and really significant safety concerns in terms of brain bleeding and brain swelling, which occurs in 30 to 40% of patients over the 12 to 18 months of treatment period. So it is pretty risky medication with very unclear benefit.
Mm.
We do have a couple of older medications that are still used. Again, they have been disappointing. Some people might find some modest benefit with them, and that includes donepezil, which is an acetylcholinesterase inhibitor, and memantine, which is an NMDA antagonist. Both of these can be used. They're, certainly potential for side effects, and not everybody will get any benefit from them. So understanding what to look for in terms of side effects, and certainly stopping them if you're not seeing improvement or if any side effects develop. We actually do have a dementia practice resource on the clinical library in Health Connect that any region can access. And it's a very helpful guide, for just a quick guide for when to consider using these medications and what to be monitoring for.
That's really helpful too. In my understanding, correct me if I'm wrong here, is those medications sort of help kind of slow the decline in the progression of cognitive impairment and dementia versus kind of any improvement. Is that correct?
Yeah, they don't necessarily even slow the decline. They've just not been. Some people may seem to feel like they're a little bit sharper. It's not the sort of thing that is normally very clinically significant. I really rely heavily on caregivers to give me some feedback about how it's going, but nothing really slows the decline, and certainly things will continue to progress, sadly.
Yeah. Again, disappointing is the word you used.
Yeah.
Yeah.
And, I would say, though, that there is so much that we can do, even though prescribing medications is not a great option for this particular disease. There's just a lot of non-medication support that we can be providing to both our patients with dementia and their families.
Yeah, you read my mind. That was sort of my next question. Is a lot of the care is sort of environmental modifications around the patient versus actually, bread and butter medications. Tell us more about a lot of those kind of the evidence for environmental modifications and caregiver support and things like that.
Yeah, I think that when you think about dementia, it is a chronic disease, and it's going to be slowly progressive. And patients and caregivers will have different needs kind of as they go along that journey of the illness. And quality dementia care really needs to be individualized, comprehensive, dyad-centered, really involving the caregiver as well. And well-being should be the overarching goal. We need to be making sure that people are living the best lives they can with this disease and caring for a loved one with this disease. And so I think, making sure that we're asking patients and caregivers what matters most to them and aligning our care with what matters most is the bottom line. I think that that's the most important thing. So, just-in-time support and education is so helpful. You have to structure activities to match patients' abilities and kind of where they are cognitively. And I have a quick story to share. I have a patient who has dementia, and her caregiver, they've always loved doing big jigsaw puzzles together, those 1,000-piece puzzles. And as her disease has progressed, she can no longer really do those, but the caregiver will still complete a big old puzzle, and then he'll strategically remove like 10 pieces and sit her down in front of it and allow her to with a little encouragement, complete the puzzle. And she gets such a sense of accomplishment from being able to do that. It's still challenging for her, and he really gets the joy of watching her do that as well. And I think it's a wonderful example of how you can still find joy in activities, and you just need to do things a little differently.
Yeah, that's such a great story. Thank you for sharing that. It definitely humanizes this disease for sure. Tell us. I lost my train of thought. There was a question here in the chat that I'll jump to here regarding sort of genetic predisposition to Alzheimer's. And if someone has a family history or a strong family history of Alzheimer's, what do we know about sort of that genetic predisposition, and does that change prevention and treatment at all in that process, or help delay the onset if we're worried?
I don't know that it does. So the ApoE4 allele genes do increase a person's susceptibility to developing dementia, but there are people who have two copies of that allele that never develop Alzheimer's, and certainly many people that don't have either that do develop Alzheimer's. And so I don't think that it's particularly helpful. I would still recommend all of the things that we were already talking about that you do just to stay healthy and live well. There's an accurate diagnosis is really important for people who are experiencing symptoms, having impairments, some functional concerns. There's really no evidence to support pre-symptomatic diagnosis in everyday practice.
So a common question that I get from my patients are, I walk into the other room, I forget why I was there. I call my kid the dog's name, vice versa. Like, what's kind of normal age-related sort of cognitive changes, and what sort of pathologic and should raise red flags for both families and clinicians? Can you help us kind of tease that nuance out a little bit?
Yeah, so normal age-related memory changes happen. And I oftentimes use the example of if you have trouble coming up with that name right when you want to, like, oh, who was in that movie? And it's not coming to you. That is not a sign of dementia.
Oh, good. Thank you.
I think about it as it's almost like we have file cabinets up in our brain that we've stored all of this information over the years. And when you're trying to find something, you have to look through a lot of files to find what you're looking for. When you're 11 years old, your file cabinet is pretty empty and you can find things pretty easily. So those types of things are very normal. I think that for many people, it's when the families start to notice some problems. And many times people with dementia don't really have that insight. Sometimes early in the disease they do, and they're frustrated by the memory problems that they're having. But if it's not causing functional impairments and it's the forgetting where you put your keys, not to worry.
Yeah, I remember when I was a resident, when I rotated through geriatrics, the comment or the rule of thumb that they gave me was, if the patient is worried about their memory loss, it's probably not as concerning as if the family members are worried about the patient's memory loss. And I kind of always remember that I use that line a lot in my own practice as well.
Yeah, good advice.
Well, this is fantastic. I do want to kind of wrap up here just to keep this high yield, but I have a few other questions first. So tell us more about where physicians and caregivers can learn more, but also tell us about the CME course that you're participating in with the Kaiser Permanente Institute of Health Policy as well, too. I'm interested in hearing about that.
Yeah. So there is a group out of Georgetown called Farmed Out that really does evidence-based prescribing, free of industry sponsorship, and does a lot of educational programs. And so I recently recorded a CME CE, you can get credit for it. And it's called Mild Cognitive Impairment in Alzheimer's, First Do No Harm. And credits available for physicians, PAs, nurses, pharmacists, psychologists, social workers. And I hope you check it out. It was a fun thing to do. The KP Institute of Health Policy partners with Farmed Out and Georgetown in this effort, and that's how I was looped into that.
That's awesome. I'm writing this down. Where can our audience find that again?
So Farmed Out. If you just Google Farmed Out, PHARMED.
I like that. Perfect. Thanks I'll definitely check that as well too. One other quick question here, because this is one that I've heard as well too. I want to get your thoughts on this. Is there's been some people read about calcium supplements can actually be more of a risk of increasing vascular dementia and infarcts versus sort of the benefits of osteoporosis and bone loss as well too. Can you share any thoughts on that, or if you have any information about that?
Yeah, I don't know that we really know that for sure. However, I always tell people that if they can, they should just get calcium in their diet. It's really not that difficult to get 1,200 milligrams of calcium a day in a healthy diet. It's in lots of different food, even if you're not a milk drinker. And so I think it's better absorbed, and then you're getting all of the benefits of leafy greens and all of the things that have calcium in them. So I'm a fan of just having people eat healthy.
Sounds like a great lifestyle medicine recommendation as well, which I would second. Well, last question here. Tell us what makes you most proud to be a Permanente physician.
Oh, there's so many things. So I would say broadly, I love that we have a thoughtful, evidence-based, data-driven approach to population health, really with an emphasis on prevention. But from an individual taking care of patients in the clinic standpoint, I have to say that good medicine requires teamwork, and I think Kaiser Permanente does such a good job of building teams. I get to work with wonderful colleagues in primary care and specialty care, and we work together with interdisciplinary teams, clinical pharmacists and nurses and social workers and dietitians. And, it's just a wonderful group of people to partner with in caring for our patients.
Wonderful, wonderful. So well said. Thank you so much, Dr. Lippard, for joining us. It's been really helpful. I appreciate your time.
Thanks so much for having me. It was a pleasure.